Hello, everyone, and thank you for tuning in. In this episode, Dr. Diane Berson will share some highlights and clinical pearls regarding oral therapies for treatment of acne. Thank you for being with us, Dr. Berson.
Thanks so much for having me.
Can you discuss how the microbiome is affected in treatment of acne patients?
Well, in actuality, there's dysbiosis already in patients with acne. We have a disrupted microbiome. But when we treat acne, the two issues you could potentially deal with is first, the topical treatments can definitely disrupt the barrier. They can cause some peeling and scaling and dryness, and you lose your barrier function. That affects the pH, and that changes the microbiome and allows growth of other bacteria, and it also leads to inflammation. So the treatment itself, when it affects the barrier, will definitely have an effect on changing the microbiome. But also when we treat acne patients with antibiotics, especially broad spectrum antibiotics, we're also changing the microbiome. And so this is causing disruption of it even further.
Can you explain which antibiotics are better in terms of resistance?
Well, the oral tetracyclines are still all very effective for treating acne. In terms of resistance, topical erythromycin and clindamycin certainly show the most resistance. And then in terms of the tetracyclines, tetracycline itself shows the most resistance, followed by doxycycline and minocycline. But doxycycline and minocycline are used very frequently and they work very well. They're just broad spectrum. So when you are taking that type of an antibiotic, you are targeting other organisms at the same time. So in some patients, we might want to think about using more of a narrow spectrum antibiotic, which might target more of the specific organisms that we want to treat in the condition and not therefore affecting other organisms that are present in the oropharyngeal cavity and the GI tract and other places in the body. And also when it comes to antibiotics, we can use a sub-antimicrobial dose, which means it's not an antibiotic, but we're using it as an anti-inflammatory. But the bottom line is we don't like to use any antibiotic as a monotherapy, either topically or orally.
What are the core principles of antibiotic stewardship?
Well, that's a great question. Officially, in terms of antibiotic stewardship, the CDC has actually, because of concerns for resistance, they have made an initiative to promote the appropriate use of antibiotics where patients receive the right dose of the right antibiotic at the right time for the right duration. And this is really referring to antibiotic dose antibiotics. But when we treat patients with antibiotics, if we want to practice good stewardship, we want to use the antibiotic for the shortest amount of effective time, try to get the patients off the antibiotic when they clear. In some instances, we might want to opt for a narrow spectrum antibiotic, which is targeting just the organisms in that condition and not affecting the others in the body so that we're targeting those. And then again, with stewardship, we're adding topicals to help decrease the development of resistance.
What is your personal approach to minimizing antibiotic resistance in acne?
Well, again, resistance is a potential issue, and actually resistance can be transmitted to personal contacts in the household. So it is something we want to avoid. So personally, when I give an oral broad spectrum antibiotic, I like to limit the duration. I usually don't go more than 3 months, sometimes between 3 and 6 months. But if I don't see improvement by then, I'm probably not going to get improvement. And that's when I might think of adding in other orals, such as hormonal treatment in women and isotretinoin for women and men. I certainly avoid antibiotic monotherapy and especially topical antibiotic monotherapy, because that's definitely going to increase the risk of resistance. And it's important to combine the topical antibiotics that you're using or even oral ones with topicals, especially benzoyl peroxide, which will decrease the development of resistance. And I think combining the regimen with topical benzoyl peroxide and retinoids will help decrease the development of resistance. And if I'm treating patients with inflammation who I think need long-term treatment, that's when I might opt for the sub-antibiotic dose, which is the anti-inflammatory dose of the antibiotic.
Thank you so much, Dr. Berson, for sharing your insight with us today. We appreciate your time.
Thank you so much for having me.
Thank you. And thank you to all of our listeners. Until next time.